Hello, everyone, and thank you so much for joining us for yet another edition of Educating for Public Health Literacy with Tolu Omodara here on Amogi Trading Communications. It's been a very exciting journey so far, and honestly, we are just about to go deeper. So, last week we looked at Australia. If you remember, if you were with us, and if you're not with us, we looked at Australia. We looked at some research that had been done comparing people who were health literate with people who were health illiterate or health semi-literate, if I can put it that way. And look, the level of health literacy was correlated with the health outcomes of these individuals. And of course, the data was clear that the more health literate people were, the higher the chances of them being much more effective in the management of their health. We also saw some inferences like the fact that health professionals tended to engage more effectively with people who were health literate, and it was easier to follow up, provide more information, and so on and so forth. And last week we looked at it more from the perspective of health being a personal responsibility and public health being a collective responsibility. Like we've always been saying on the precursor programs to this program, and we've been saying on this program, public health, like I remember mentioning, like Dr. Mololo Majakurumi will always say, a public health expert, public health is a collective responsibility. However, like I said, I think in the first edition of this program, public health is a collective responsibility, but the accountability, it remains with government. And when I say government, policymakers, policy implementers, or private health players in the public health sector. Now, this part is one thing we are going to zoom in on this episode, and we are also going to look at it from the lens of another country this week, and that is the United States of America. What exactly is the role of public health players, right? Public health managers and leaders of public health policy space, right? In ensuring that we have public health literacy, right? And we have that the public is health literate, to guarantee the outcomes that we have already seen to be highly correlated with higher levels of health literacy. What is this role that public health policymakers, public health policy implementers, even private sector players in public health should be playing to engender and facilitate increased and effective health literacy, or at the very minimum enhanced health literacy, even if it's not yet effective, right? This is one of the things we're going to be looking at on today's episode. My name is Tolu Omodara, and it's such a joy to have you with us. We'll be back shortly. So there's one thing I want us to first take note of. The role of organizations in health literacy is one thing that some policymakers have been drawing attention to, right? So there is the personal health literacy, but there is also the organizational health literacy. And they've looked at organizational health literacy and sort of classified it as the degree to which organizations equitably create and enhance individuals' access and ability to find, understand, and use information and services to inform health-related decisions. Right. So, we've been defining health literacy as the ability to obtain, the ability to process, the ability to comprehend, and the ability to utilize health information to make informed health decisions. Right. But we've been looking at it a lot from the personal point of view, the ability of individuals to do that. Right. As we begin to go into the level of accountability and not just responsibility, personal responsibility, but accountability, it's time to say, how can organizations, right? It's time to begin to say, how can organizations, enable this as well? Because, one of the things we've been saying in precursor episodes, in previous episodes, is that ordinarily, one of the easiest ways to, build health literacy is through the regular school system, and that's for young children. And I think I remember in the very first episode we shared the data of health literacy measures between children and adults, and it was found that children were significantly more health literate than adults. Of course, that's easy because they are still passing through schools, and you can still, we can still easily build health education for health literacy into their regular curriculum. And I remember that in that first episode and the subsequent episode, I believe, we spoke about, the need to think of how can we innovate, right? How can we come up with innovative ways of ensuring that even adults who have, sort of exited the regular school system are health educated, right? Let me put that as simply as possible. So health education leads to health literacy. Health education is easier to achieve in the regular school system for children, but even adults who have come out of the regular school system that somehow missed out on the health education for health literacy or did not attain the required levels of health literacy still have to achieve that health literacy for the sake of their health outcomes, right? So we've been talking about the need to innovate, to find innovative ways to ensure that even adults become health educated. Now, one of those innovative ways is what some researchers, some policymakers have already identified as organizational health literacy. I think this is very important because even if you're not in school, as a child or as a teenager or as a young person, you are likely to be working. So organizational health literacy is one of those innovative platforms or channels through which we can, ensure health literacy among adults. And it has been defined as the degree to which organizations equitably enable access or equitably enable their employees and individuals to find, understand, and use information and services to inform or to guide health-related decisions and actions for themselves and for others. Now, there are so many ways that this can be done. Organizations typically have HRs, departments, and within those HR departments, ordinarily you will have learning and development units, and you will have what you call a training and development plan. Normally there will be a training and development calendar across technical areas, but when I say technical areas that are technical skills for different fields, right, and different organizations and different industries. But you also have areas of non-technical trainings. Sometimes you will get sent for trainings on what is called soft skills. Sometimes you will need to be trained, or employees will need to be trained on organizational values, and so on and so forth. So organizations can promote health literacy by including health literacy as one of the outcomes of their training and development programs. And this is really important. In fact, in these days when we have to talk a lot about mental health, and mental health is significantly impacting organizational outcomes, employee performance, not to talk of physical health, this is definitely a priority learning point, a priority training and development goal. So this is one of the areas we can innovate. This is one of the platforms, this is one of the channels through which we can ensure that adults that are out of the regular school system are still getting health education in order to ensure or facilitate health literacy, organizational health literacy, right? And so organizations can support their staff, right? And they can also collaborate even with government where necessary, right? Collaborate with the Department of Health to ensure that they receive the support needed. For instance, if they want to either write curriculum or use existing curriculum, they don't need to reinvent the wheel. They can partner with public sector institutions that are focused on these Department of Health units within the Department of Health to ensure that they have sufficient learning materials, also have the appropriate learning or training personnel, or collaborate or outsource whatever they need to do. They can do this to ensure that they are promoting health literacy, especially of adults who are employees in their organizations and out of the regular school system. This remains Educating for Public Health Literacy. It's getting more interesting and we are going deeper, and we'll be back shortly. Welcome back. It's still a very interesting edition. We are going deeper, like we said, and we are beginning to look at how can we facilitate enhanced public health literacy. We're going beyond the responsibility that it is, it's a collective responsibility, but it is the accountability, it is within the scope of the accountability of policymakers of policy implementers and so on and so forth. So in 2010, right, I said this episode we are looking a little bit at the United States, a little bit more specifically at the United States. Last week I looked at Australia. In about 2010, the United States actually came up with a national action plan to improve health literacy. Can you believe? A very specific national action plan to improve public health literacy. And the goal of this was to seek to engage organizations, remember I just said organizations, professionals, policymakers, communities, individuals, and families in a linked multi-sector effort to improve public health literacy. I'll repeat that. The goal of the National Action Plan to improve health literacy, right, or the National Action Plan to improve health literacy had a goal to engage organizations, professionals, policymakers, communities, individuals, and families in a connected multi-sector effort to improve health literacy. So one of the things that we may not be able to finish dissecting this National Action Plan in today's episode, but let's at least begin. So one of the things that this National Action Plan decided to do was to explore a multi-sector approach. So the organizational health literacy I just spoke about is one of the things the National Action Plan engaged in, right? How can we use organizations to enhance health literacy? But they also wanted to work with communities. They similarly wanted to engage with family structure, because these are also powerful channels of, pushing health literacy. Communities like churches, like non-profit organizations, of course, the family structure, especially when you think of the extended family, these are channels, or these are existing societal structures that they can leverage to enhance health literacy, especially among the adults that are probably, like we said, already out of the regular school system. So the National Action Plan to improve health literacy sought to engage organizations, professionals, policymakers, communities, individuals, and families in a linked multi-sector effort to enhance health literacy. Now, this action plan was based on two core principles. One, that all people have the right to health information that helps them make informed health decisions. I'll repeat that. It was based on the principle that everyone has the right, this is health equity, that everyone has the right to health information that helps them make informed health decisions. The quality of their health decisions cannot exceed the quality of the information available to them. The second principle it was based on is that health services should be delivered, right, in ways that are easy to understand. Health services should be delivered in language, in linguistic constructs that are easy to understand, and therefore enhance the health, longevity, and quality of life of the people. Let me tell you one of the things the research found out in the course of coming up with this National Action Plan. Let me tell you all the things that the research indicated that was quote and unquote sort of concerning, right? Concerning for the division of the Department of Health that was responsible for coming up with this action plan. 2 decades of their research actually indicated that health information is presented in a way that is not usable by most Americans. 2 decades, 20 years, about 20 years of monitoring this was saying to them that the way health information is presented is not usable by most Americans, right? Nearly 9 out of 10 adults were said to have difficulty using the everyday health information that is routinely available in healthcare facilities, retail outlets, media, and communities. So without clear information, if people don't understand, if there's no clarity, and there's no comprehension as a result of lack of clarity, how then can people take the preventive steps necessary to forestall preventable health issues, right? And then when they do have some conditions, how then can they effectively manage those conditions on their own? Another thing they discovered is that people are actually more likely to skip the necessary medical tests and end up more often in the emergency room when they have poor health literacy. In addition to that, when they have chronic diseases such as diabetes or high blood pressure, they are also less likely to be able to manage this effectively in the absence of effective health literacy or even a basic level of health literacy. This is an issue. It is an issue that cannot be swept away. It's an issue that cannot be explained away. It's a major issue that needs to receive a lot of prompt, continuous, consistent, and measurable attention. This is still Tolu Omadara on Educating for Public Health Literacy. We are going deeper today. We are going beyond this being our collective responsibility to it actually being within the scope of accountability of decision makers within the public health space. And we are also we've also looked at the role of organizations, how organizations can facilitate health literacy, especially for adults, but even this is still within the or under the scope of overall policy, right? And we're also looking specifically at the country, the United States of America, and looking at what the US, for instance, did with the National Action Plan to Improve Health Literacy, which they produced in 2010. We'll be back shortly. Thank you for being with us. So, the National Action Plan to Improve Public Health Literacy had 7 goals, right, that would improve this area, right, and strategies for achieving those goals. I'll run us through those 7 goals quickly. The first goal was to develop and disseminate health and safety information that is, 1, accurate, right, and also actionable and as well accessible. I'll repeat that. To develop and disseminate health and safety information that is accurate, very important, no misinformation. We've talked about what misinformation or the lack of information can do in precursor programs, right? Very, very important. We also what happened during the days of the peak of COVID as a result of poor information or misinformation. So the first goal is to develop and disseminate health and safety information that is accurate, but accessible as well, and of course, actionable. Remember, health literacy ultimately is about empowering people to take informed decisions with regards to their health or the health of others, especially before the medical personnel can come in. Number 2, to promote change in the healthcare system that improves health information, communication, and decision making, as well as access to health service. That was another goal of the Health Literacy Action Plan, the National Action Plan to Improve Health Literacy, to promote change in the healthcare system that improves health information, communication, decision-making, and access to health services, all as a result of enhanced health literacy. Number 3, to incorporate accurate, standard-based, and developmentally appropriate health and services information, right, and curricula in childcare and education all through the university level. In other words, simply say, to ensure that information is available, through those channels that we've talked a lot about, the education channels, and this health information, of course, must be accurate, must be standard-based. So when we say accuracy, there's actually a standard, a metrics based standards for measuring accuracy. Also ensure that information is developmentally appropriate to different age levels, right? And ensure that this is incorporated into the curricula of children, right, from their care, if you like, all the way to university level. This was the goal in the National Action Plan of the United States to improve health literacy. It's actually written in black and white that part of the goal was to continue to build on what is well known, right? The channel of the regular education system that is well known. And for them, when they created this action plan, it was not just about doing this through K to 12, but all the way to university level, to continue to ensure that health literacy is being pushed intentionally in a very standard-based way, right? And therefore in a way that is measurable. If it's standard-based, then it's easy to measure that, right? This is interesting. I'm enjoying it personally. I hope you're learning and also enjoying it. Right. The next one, to support and expand local efforts, this community level now. Support and expand local efforts to provide adult education. We've gone out of the school for children. The fourth one is to support and expand local efforts to provide adult education, right, and culturally and linguistically appropriate health information services. I really like this one. Culturally and linguistically appropriate health information services in the community. So when you're sharing the health information, remember the action plan was based on the principles that one of the principles that is based upon is that all people have the right to health information that helps them make informed decisions, and also that this information should be delivered in a manner that they can understand. So based on this, right, the goal was to ensure that they support and expand local efforts to provide adult education and culturally and linguistically appropriate health information services in the community. Is very, very important. Not just that they can understand language, but that the information is also made culturally contextual. It must be contextualized in a way that enhances comprehension. So you're not just passing across information, but you're actually communicating. So I really like this part of the 7 goals of the National Action Plan of the United States to improve health literacy. The next goal is to build partnerships, develop guidance, and then change policies. In other words, you have to keep reviewing this. It's not a one-off. Then also to increase, this is another one I really liked, increase basic research and the development, implementation, and evaluation of practices and interventions to improve health literacy. I'll repeat that. To increase basic research and the development, implementation, and evaluation of practices and interventions to improve health literacy. We're going to dig more into this in subsequent episodes. In other words, this is not a one-off. One of the goals was to keep researching how can we improve health literacy, how is it growing, how are people responding, and so on and so forth, right? To increase basic research and the development, implementation, and evaluation of processes, practices, and interventions to improve health literacy. How well is it going? And last but definitely not the least, the 7th goal is to increase the dissemination and use of evidence-based health literacy practices and interventions. I like this a lot too. Increase the dissemination and use of evidence-based health literacy practices and interventions. This was the 7th goal of the National Action Plan of the United States to improve health literacy. Like I said, there's only so much that we can take in this episode. We're going to go deep into this in the subsequent episode. How well did the US, implement this? How well have they gone? Has it been reviewed? Has it been measured? What went well, what went wrong, if anything went wrong, what are the lessons to learn, and so on and so forth. But I actually like the fact that there was at least a national action plan to improve health literacy, and that these goals, were articulated based on those core principles that everyone has a right to information that will enable them make effective health decisions. And I really also like the fact that there was a drive, there was a commitment. This by the way was signed off by the then Assistant Secretary of the Department of Health at the federal level. So this was not taken with quote unquote levity at all. This was something that a lot of focus was given to, right? And we're going to draw a curtain on this week's episode about this point, but don't forget what we have been looking at. We are building on where we have been. We've been looking at the need for educating for public health literacy. We've talked a lot about what happens with those who are health literate versus what happens with those who are not health literate, and we've shared data with us that clearly indicates that the more health literate people are, the better they are able to take care of their health, right? And now we are beginning to look at solutions, especially to 2 core questions we have been asking since the beginning of this program. We've been asking, okay, how can we consolidate on the known channel of education? Is a known channel already that the regular education system is a way, or is a channel, is a platform through which we can enhance literacy, health literacy amongst children, right, up to teenage stage. We've shared data that shows that they tend to be more health literate because of those existing systems. But we also talked about the need to establish and consolidate upon those systems. We also talked about the need to innovate, right? How do we ensure that the adults that seem to have left those regular educational systems are still being, given or still being, quote and unquote, driven towards the level of health literacy that will enable them make informed health decisions that will enhance their health outcomes. Those are the two questions we've been looking at, and we are also looking a little bit more specifically into the United States. We've looked at Australia last week, we looked at an example or a case study from Australia last week, and then this episode we are looking at the National Action Plan to Improve Health Literacy that was created, articulated in the United States in 2010, and we've looked at the goals that were created, that were written, that were laid down, the goals that were set forth, and we generally like the fact that these goals, are established upon the principles that health literacy is more or less everyone's right, that and it was also based on the understanding that the degree to which individuals have the capacity to obtain, process, and understand basic health information and services would actually enable them make more appropriate health decisions. So health literacy is almost as important as quote unquote other health services. In other words, health literacy is a core part of the so-called other health services, if you can really call them other health services. Like we said, I think last week, part of the challenges is that if you even invest in a lot of health facilities and health services, but you don't have adequate health literacy, as a nation, as a region, as a state, you may more or less be wasting the investment, because the data also shows that people don't even take advantage or take optimal advantage of those health services because they are not aware of them as a result of poor or inadequate health literacy. So this is a lot on which we are going to draw a curtain today. Remember, we've begun to look at a very specific action plan in another country, and we'll continue next week to look at this national action plan to improve health literacy. We're going to look at how well it was implemented, what were the lessons learned in the process, what did they do well, what did they need to take forward, and what can other nations learn from this. This has been very, very nice. As always, very interesting, very enlightening, very instructive, and we are always grateful to have you with us. Please join us again, same time, same station next week. And remember to spread us your comments, send us your questions. You can follow us on Facebook, you can follow us on Instagram, you can follow us on LinkedIn, Amourgate, ARMOURGAT. You can also send us an email if you want, at contact@theamourgate.org. You can also send us a WhatsApp message on +234 810 999 6666. Our WhatsApp number again is +234 810 999 6666. Thank you so much for doing this with us. We look forward to being back with you same time, same station next week. It's getting much more interesting. My name remains Tolu Omodara. This is still Amourgate Radio Communications, and the program has been Educating for Public Health Literacy. Thank you.